of endocrine diseases, starting with the pancreas, meaning diabetes. So, a diabetic patient has different ocular feature starting from the pupil. The pupil is often small due to the autonomic neuropathy. The patient can also have cataract. Usually, this is a snowflake cataract. The classic one is a snowflake cataract. So, small pupil, snowflake cataract. And when you do the fundoscopy, we find the classic features of diabetic retinopathy, starting from the microaneurysm, dot and blot hemorrhage, hard exudates, and in case of proliferative retinopathy, we will find the neovascularization. Next up, thyroid disease, Graves' disease. So Graves' disease patient typically has proptosis, right? And proptosis causes exposure, and the exposure leads to an exposure keratopathy or corneal inflammation due to the exposure. And there is also conjunctival inflammation and edema, as there is fibrosis and deposition of myxomata substance in the ocular muscles. There is restricted motility of the eyeball, and when there is excessive compression over the optic nerve, it can lead to optic neuropathy. Next up, parathyroid disease, hypercalcemia. So hypercalcemia can lead to something called a band keratopathy, where there is calcium deposition in the cornea. Cushing syndrome classically causes posterior subcapsular cataract. And then pheochromocytoma from adrenal medulla. Usually this leads to hypertension, and hypertension causes hypertensive retinopathy, and it starts from silver wearing, then goes to AV nipping, cotinal spot, and ultimately the grade 4 is papilloedema. Those are the ophthalmic features of endocrine diseases.